Ashish, I am assistant professor in RPIIT pharmacy, and in this video I will discuss about the disinfection in hospital prevent from any infection or hospital acquired infection. The disinfection is a process where most of microbes are removed from defined object or surface except spores, that is, they can be classified according to their ability to destroy different categories of microbes, that is high level disinfectant, intermediate level or low level. High level disinfectant are glutaraldehyde, ethylene oxides. Intermediate level disinfectant alcohol, chlorine compound, hydrogen peroxide, chloroxylene. Low level disinfectants are benzalkonium chloride and some soaps. The guidelines for disinfection is the critical instruments and equipment that are those penetrating skin or mucous membrane should be undergo sterilization before and after use. Surgical instruments, some semi-critical instruments that in contact with mucous membrane without penetration should undergo high-level disinfection before use and intermediate level disinfection after use. Endotracheate tubes. Non-critical instruments or equipments are those in which they on contact with only intact skin and requires only intermediate or low-level disinfection before and after use, that is ECG electrodes. The role of physician in hospital acquired infection. Physicians have unique responsibility for the prevention and control of hospital acquired infection by providing direct patient care, using practices which minimize infection by following appropriate practice of hygiene, that is hand washing, isolation, protecting their own patient from other infected patients and from hospital staff who may be infected, and complying with the practices approved by the Infection Control Committee, obtaining appropriate microbiological specimen when an infection is present or suspected, notifying cases of hospital acquired infection to the team as well as admission of infected patients. And the role of hospital pharmacists is also very necessary to prevent infection from hospital acquired infection by obtaining, storing and distributing pharmaceutical information using practices which limit transmission of infection agents to the patients, and maintain the course of antibiotics distributed to the medical departments, providing antimicrobial use committee and infection control committee with summary reports and trends of antimicrobial use, providing summary reports of prevalence of resistance, monitoring sterilization, disinfection and the environment where necessary, and also participation in development of guidelines for antiseptics, disinfectants and products used. Role of nursing staff in prevention of hospital acquired infection is also very important. Implementation of patient care practices for infection control committee. The role of nursing staff. The senior nursing administrator is responsible for participating in the ICC, promoting the development and improvement of nursing techniques, ongoing review of effective nursing policies with approval by the Infection Control Committee. Then the Central Sterilization Services CSSR is also very important to oversee the use of different methods, that is physical, chemical and bacteriological, to monitor the sterilization process, ensure technical maintenance of the equipment according to national standards and manufacturer recommendation. Role of the food service is also very important. The food service must be knowledgeable in the food safety. The head of catering service is responsible for defining the criteria for the purchase of foodstuff, equipment use, cleaning procedure to maintain high level of food safety. So these are the prevention and control guidelines by the physician, staff nurse and food and catering services and pharmacists. Thank you.